Dr. Hawary, let's talk teeth bleaching or teeth whitening. Lots of people like it, want it these days more and more apparently. People drink coffee, wine, and all that type of stuff. They smoke, of course, still. From what I know, there are three kind of major ways of going about it. You buy something over the counter. You go to a dentist and get a professional teeth bleaching kit, and you put it on. Or you go to a dentist again, and you do something which is done in a half an hour or whatever it takes, very little time. You use a particular laser machine, blah, blah, blah. Go ahead and tell us a little bit the pros and the cons of each one of those methods. Start with the over the counter and then work your way up to the more expensive one also. And tell us what a patient can expect and which one is good for him when.
Okay, there are a lot of products nowadays for bleaching the teeth, from over-the-counter products that can be not as effective because of the ingredients and because of the concentration of the ingredients in it, versus the other kinds, which one you mentioned is the take-home bleaching, where you have the trays that made for, custom made for the mouth, with the gel that you put in for several nights or days until the results take place. It takes a little bit longer, and the reason is the concentration of the bleaching material should not be very much, because it can be burning or harmful for the gum if it goes into the gum. However, because those trays are fitting better than the over-the-counter stuff, then they would definitely be keeping the material more and has a better effect on the result. Versus the last one.
So basically, the ones over the counter, the tray doesn't fit so well because it's just an arch, so it spills over a little more, and that's why the material which is supposed to do the bleaching is much weaker. Otherwise, it would burn the person's mouth and cheeks and whatever, right?
Exactly, and even that can be said compared to the third way, which is the in-office bleaching, because here we separate the gum, isolate it, put material to protect the gum completely, where we apply the bleaching material on the teeth with a much higher concentration activated with that certain kind of light that makes the process much faster. So it's how much concentration and how much more that we use in the in-office bleaching, because we protect the gum, versus less in the take-home, because the gum is not protected, but the material will not go out of the tray as much as the first one, which is the take-home, the over-the-counter, which doesn't fit the teeth. It's not custom-made, and the material can go out of it very easily, so the ingredients are not very high concentrated, and it will take much longer to get the same effect.
So,
never get the same effect.
Tell me, the one in the office, how long does it take the visit? Is it a half an hour visit, and then you're done with and you can go home?
It takes an hour. We do around 3 sessions of 15 to 20 minutes of the material applied on the teeth, and there is another 10-15 minutes of isolating the gum. So it's around an hour, more or less. Then we found out in my practice, one of the things that we also provide and give to the patients is combination of both, because the in-office bleaching is a very beautiful result, very fast, the best result in the shortest time. However, with consuming red wine, coffee, tea, etc., teeth can get less white over time, and that's why we combine that with the take-home bleaching, where we give the patient bleaching trays fitted to their mouth and their teeth, and they have the material as a touch-up kit. So you don't have to use it for a very long time because the teeth are already whitened, but they can use it, to touch up the color and make sure that it stays the way it became.
Kind of a little maintenance program. Let me ask you, Dr. Hawary, a person gets his teeth whitened. First of all, are there any type of side effects from this thing, from this whitening material, whatever the heck it might be?
We can't call it side effects, but some in general, bleaching makes teeth a little bit sensitive at the time of doing them. But some people are not yet prepared to have their teeth bleached because they have more important things going on, whether lots of enamel erosion that makes the teeth more sensitive. These need to be protected or filled prior to do that, or a lot of calculus and buildup, and they need to have the teeth cleaned and the gum healthier to take the bleaching and get a better result as well. So sometimes if everything is okay, teeth may get a little bit temporarily sensitive, but some people need some preparation work or stuff to be done before they have their teeth bleached if they don't want to get their teeth very sensitive.
So that makes a good point. For the people who buy a home bleaching kit in the pharmacies, they should at least go to a dentist first, get their teeth cleaned, because otherwise they may have calculus on it, and then when they finish bleaching, they may look like one of those checkered cows or something like that.
Well, absolutely. I mean, not only for better results, but for a healthier mouth in general. We don't want to bleach on calculus. That's not the way it should be.
Right. So good. And so a person has done it. Whichever way, and he got his good result. He has used one of those three methods. And I think you answered the question by giving home a maintenance kit. But let's say, because most people do not change their lifestyle. They will not stop drinking red wine, coffee, and whatever it is they do, because we don't even do that for our diet. We know we whatever have a problem, and even there we don't change. So never mind for yellow teeth. Can he a year or two later go again and do a nice, beautiful bleaching, or whenever it comes back? Basically, can it be redone and redone and redone the rest of their life?
Yes, absolutely. It can be done. Patients have it redone several times. Nothing happens. And if the teeth getting to be at a certain level sensitive or more sensitive than it should be, then they shouldn't do it. But if the teeth are not sensitive, it means that it can be done and there's no problem with that.
Thank you very much, Dr. Hawary. Thank you very much.